This is Dr. Kobe Redfield. I want to talk about a matter that is personal to me since I've had several family members struggle with this in the past, and it revolves around opiate addiction and the involvement with EMS. This is a patient population that we often see and typically struggle with, and how do we help them in the future and try to prevent further overdoses and continued opiate dependence? We have a unique window where the patient is typically motivated, had a crisis, and we're right in front of them and able to help them hopefully conquer this disease. Pre-hospital buprenorphine bridges that gap for long-term treatment. Even if the patient doesn't want it at this time, we can at least give them the resources and help them maybe in a future crisis. First thing we got to do is look for people that have signs of withdrawal or symptoms. These include, but not limited to, agitation, diaphoresis, diarrhea, dilated pupils, lacrimation, piloerection, goosebumps, restlessness, rhinorrhea, tachycardia, vomiting, or yawning. If two or more of those are present, then we can move forward to see who's actually included and excluded from our criteria. Our inclusion criteria include somebody under the age of 16, if they have altered mentation, they lack capacity to make decisions. A key one to look at is if they have used methadone in the last 10 days. And lastly, if they have any severe medical or traumatic condition which takes priority in care over the opiate addiction problem. Once you determine that they don't have any exclusion criteria, you then have to calculate a COWS score. And COWS stands for Clinical Opiate Withdrawal Scale. And there is 11 components to this score. The first one is the resting pulse rate. You get 0 points for 80 and below, 1 point from 81 to 100, 2 points for 101 to 120, and 4 if it's greater than 120. The second thing you're going to look at is sweating. 0 means no reports of chills or flushing. 1 means that they report chills or flushing. 2 is that you see flushing or moistness on the face. 3, you actually see beads of sweat on the brow or face. And 4 is the sweating streaming off the face. Next area to look at would be how restless they are. 0 is, are they able to sit still? 1 is reports difficulty sitting still but is able to do so. 3 is frequent shifting or extraneous movements of legs and arms. And 5 is that they're unable to sit still for more than a few seconds. You will then move on to their pupil size. 0 is pinned or normal for room light. 1 is possible larger than normal. 2 is moderately dilated. And 5 is only rim of the iris visible. Next would be bone or joint pain. And this is not associated with injury or chronic pain, so just remember that. Again, 0 is not present. 1 is mild diffuse discomfort. 2 is described as severe diffuse aching. And 4 is rubbing joints or muscles due to pain. You then move on to rhinorrhea or lacrimation. 0 is none present. 1 is some nasal stuffiness or unusual moist eyes. 2 is rhinorrhea. And 4 is constant rhinorrhea or tears running down the face. Then you're going to look at GI upset in the last half hour. 0 is no symptoms. 1 is some mild stomach cramps. 2 is nausea or loose stool. 3 is vomiting or diarrhea. And 5 is multiple episodes of vomiting or diarrhea. Next would be tremor, and that's observation of an outstretched hand. 0 again is no tremor. 1 is tremor felt but not observed. 2 is slight observable tremor. And 4 is gross tremor. Next is yawning. Again, 0 is no yawning. 1 is once or twice. 2 is 3 or more times. And 4 is several times a minute. Then you'll move on to anxiety or irritability. Again, 0 is none. 1 is patient reports. 2 is obvious. And 4 is severe enough to interfere with assessment. And lastly, you're going to look at piloerection or goosebumps. 0 is skin is smooth. 3 is can be felt or hair standing up on arms. And 5 is prominent piloerection. And that is your full COWS score. And we are looking for a score of 8 or greater to be considered for treatment. So then it comes time to administer the medication if they qualify. We're going to give buprenorphine. And the dose we're going to give is 16 milligrams sublingual if their COWS score is 8 or greater. It's very important that they don't swallow the medication because its onset is roughly 30 to 60 minutes and it peaks in 1 and 4 hours. Duration is up to 24 to 72 hours, but they won't feel it immediately. Now, if you're going to give Suboxone, all that does is combine buprenorphine and Narcan. Now, at the 10-minute mark, you're going to reevaluate your COWS score, and if you don't get a desired reduction of under 8, you'll give an additional dose of 8 milligrams, again, sublingual. This is a great resource for our patients and our community. You can have a big impact on our patients and families. So I hope this is helpful, and if you have any further questions, please reach out to me, Dr. Kobe Redfield. Have a good day.
And that's all we have for this episode. This is a production of Redfield Medical Direction. This episode was produced by me, Lin Win. The theme music is by Infraction. As always, don't hesitate to reach out if you have any questions. See you next time.